is a civil wrong known as tort, a breach of contract if his professional behavior falls short of the requirement of the contract between him and the patient. This is the medical negligence. When there is a fall of contract between the doctor and a patient, is known as the medical negligence. For negligence of any kind to be proved, it must be shown that the defendant doctor owed a duty of care to the plaintiff. Plaintiff is a patient, defendant is a doctor. That the defendant was in breach of the duty means from the doctor side. That the plaintiff suffered damage as a result means the patient. In this slide, defendant is a doctor, plaintiff is a patient. So due to the breach of the duty, there is some suffer towards the patient. Negligence. Any person can be guilty of negligence. For a person to be judged negligence, he must owe a duty to another person. He must have committed a breach of duty. As a result, the person to whom the duty was owed must have suffered some damage. Medical negligence, the person must be the doctor's patient. The doctor accepts responsibility of a medical care of a person. If the doctor doesn't care the person, then it's a medical negligence. The doctor must have done something which is not approved by medical practice, or have omitted to do something which is accepted in the circumstances. As a result of the action or omission, the patient has suffered injury. Due to the negligence of the doctor, the patient has suffered an injury. In medical situation, medical negligence is the breach of duty owed by a doctor to his patient to exercise reasonable care and or his skill resulting in some bodily, mental or financial disability. The doctor must have reasonable degree of proficiency and apply the proficiency with a reasonable degree of diligence. No doctor is expected to possess all current medical knowledge or being able to apply all known diagnostic or therapeutic techniques, but a doctor of a particular standing as regards to his degree and experience is expected to have a standard of knowledge and capability commensurate with his status. Essential ingredients of negligence. These are the essential ingredients of negligence. Means these three things makes the negligence. Number one, willingness to examine, willingness to diagnose, willingness to treat. Anti to these things is known as the negligence. As a result, damage suffered by the patient must suffer some loss which can be made and compensated for in terms of money. For example, loss of earning, absence from work, impair of his ability to carry job, expenses, nursing home expenses, special treatment. Medical negligence can only occur when a doctor-patient relationship is established. The doctor has a duty to exercise his skill and care. For example, in acute emergency, once a doctor approaches an ill or injured person with the objective of assisting or treating him, then a completely valid relationship is set up. Even the patient is unconscious or unaware, the doctor present, for example, in MVA, a doctor is not negligent if he does not offer his services in an emergency to a person. When is duty owed? From the moment that the doctor undertakes advice or treatment, whether under contract or gratuito, at the scene of accident. A standard of duty, no doctor is expected to be perfect or infallible. न कोई डॉक्टर परफेक्ट होता है, न वो कोई मासूम होता है. Standard of competence which the patient is entitled to expect is that of an ordinary competent practitioner on the grade or specialty to which the doctor belongs. For example, a GP for performing major surgery will be expected to exercise the degree of skill of an average surgeon unless to act in an emergency when no surgeon was available. Breaches of duty. Approved practice, for example, failure to take X-ray or to give anti-sera. Number two, accurate diagnosis or misdiagnosis. For example, failure to examine the abdomen in acute appendicitis These are the breaches of the duty from the doctor's side. Huh? Risk of treatment, not negligence if reasonable care to avoid mishap, for example, broken needle. Communication with other doctors, attendance on patient, reps, EPSA, liquidator, the things speaks for itself. For example, swabs, forceps, left in the abdomen. This is a very important OSPI type of question. Medical record, the principal evidence in allegation of negligence action. For example, the house surgeon is not expected to have the same skill as a consultant surgeon, but he is expected to confine his activities except in emergencies to a level of medical care which is within his competence. A house surgeon electing to perform a major surgical operation not in urgent medical emergencies might be held guilty of negligence if damage ensues, even though he could not be expected to possess the same experience as a senior consultant who should have performed the operation. For example, a brilliant surgeon may be negligent if he fails to apply his skill as well as inexperienced surgeon may be negligence even if he claims himself to possess of sufficient competence. Degree of competency is not a fixed quality. It varies according to the states of doctor from new graduate, senior consultant. However, there is a minimal level of competence for all doctor which is guarded by the medical council. Another thing is the medical malpractice versus the medical negligence. So here there is a question: what is the difference between the medical malpractice and the medical negligence? Many times these two terms are used interchangeably, but they refer to two distinct legal concepts. Although these two words used commonly interchangeably, but they have two distinct legal concepts. Medical malpractice means that a medical professional performs their job in a way that deviates from the accepted medical standard of care, causing injury or death. Common complaints about doctors who commit malpractice include error anesthesia, again medical negligence, mistake during childbirth, medical negligence, surgical errors, unnecessary surgery, wrongful death, wrong diagnosis or misdiagnosis. Medical negligence occurs when a medical professional fails to do something that should have been done. The Urdu of this is एक चीज है जो डॉक्टर करना चाहता है, जो उसे आता है और वो नहीं करता. This is comes under the heading of medical negligence. Examples of medical negligence include failure to revise a diagnosis, failure to warn patients of the risk of treatment, failure to remove surgical instruments from the patient during surgery, failure to attend or to treat a patient, incompetence, failure to refer a patient to a specialist relevant to their disease or injury, wrongful diagnosis. There are four elements in proving a negligence case. This is the theoretical question. In theoretical question, we give the question like what is medical negligence and write down or elaborate the 4 D's of the medical negligence. Here there is a D1. D1 means the duty. A medical professional owes a duty to his or her patient. The duty is to perform with reasonable care as per the medical standards to prevent injuries. This is the duty of a doctor, and that is the D1. D2, once duty, D2 is for the breach. Once duty is established, it needs to be determined whether there was a breach of the duty. Here there is a third D, causation for a negligence claim. It is not enough that a duty was breached. The injured party must also show that the breach of duty was the cause of the injuries sustained, damage. This is the 4D. The damages we are talking about are pecuniary damages. placing a value on the harm done to the patient. The damages might include lost wages and medical bills. They could include general damages such as pain and suffering. Punitive damages, which are intended to punish the negligent party of his or her actions, could be included as well. So here we are studying the 4 Ds, which comes under the heading of medical negligence. If you feel you have been a victim of malpractice, of negligence, you should contact a personal injury attorney who specializes in those practice areas. Now let's see some slides, a little, and one or two are
against a cancer doctor in Michigan. Investigators say he was telling people they had cancer even when they didn't, then treating them just to get the money for treatment. Today, National Investigative Correspondent Jeff Ross is here with this story. Jeff, good morning.
Hey, Savannah, good morning. This is a popular doctor who has more than 1,000 patients who trusted him, of course. And so these accusations are truly alarming. Anyone who's been through chemotherapy knows how rough it is. But prosecutors say this doctor was giving chemo to people who didn't need it. Some of them didn't even have cancer, all part of an alleged $35 million fraud. This is the man, Dr. Fareed Fatah, a trusted oncologist who prosecutors say preyed on patients to pad his pockets. The FBI hauling evidence from his offices last week in upscale Michigan neighborhoods. And the charges against Dr. Fatah are disturbing. Deliberate misdiagnosis of patients as having cancer, giving unnecessary chemotherapy, even to end-of-life patients who will not benefit.
If he did indeed commit these crimes, then a monster is a very good description.
Jeff Burrs fears his father, Milton, suffered under Dr. Fatah's care, prescribed chemotherapy for leukemia. But even as his health got worse, Jeff says Dr. Fatah wouldn't stop chemo and went to great lengths to administer it.
My dad would often arrive at Dr. Fatah's office, and one of the staff would come out and actually administer the therapy session in my father's car while he's sitting out in the parking garage.
Months later, Milton died. Now his son has reached out to prosecutors.
I hate to think that my father was either hurt or had his life shortened by this man if it wasn't necessary.
Prosecutors say Dr. Fatah was motivated by money, billing Medicare for false claims, all the while living in this lavish mansion in a ritzy suburb. Federal agents have been here too, searching his home for evidence. Back at court,
Mrs. Fatah, what do you care to say to patients today?
his wife, the company's CFO, wouldn't speak.
Do you have anything to say on behalf of your husband?
But Dr. Fatah's defense lawyer did, saying his client is innocent.
They're allegations only, and they're unsupported factually and legally at this particular point.
Dr. Fatah's company now accused of defrauding the government and taxpayers out of $35 million. Officials say healthcare fraud is a growing problem.
It not only affects the patients who are sometimes put in harm's way, but also the taxpayers. All of us are contributing to the Medicare and Medicaid programs, and these are the dollars that are going out the door as a result of the greed of a few providers.
Dr. Fatah is now in jail, the judge setting his bond at $9 million, calling him a flight risk. Experts say this is a good reminder for all of us to always be alert at the doctor's office. So here is the takeaway. Always get hard copies of your medical records and make sure to look them over. And that leads us to the next tip. If you get a serious diagnosis like cancer, get a second opinion and bring those records with you. And finally, if you suspect wrongdoing or Medicare fraud, report it. It is quite easy to do. In fact, we have a link on our website right now, today.com. Just click on the Rossum Report section, and Savannah authorities want to hear from you. And they also want to hear from other victims, alleged victims of this case.
एक अहम खबर आपको लाहौर से बता दें कि महकमा सेहत पंजाब की नाअहली के लाहौर के गाजियाबाद अस्पताल में एक साकरूब सर्जन बन गया। एआवन न्यूज ने साकरूब सर्जन की सर्जरी करते हुए फुटेज हासिल कर ली है। इस वक्त राबिया नूर हमारी नुमाइंदा हमारे साथ मौजूद है। राबिया, गाजियाबाद अस्पताल में क्या हो रहा है?
जी बिल्कुल, ये तहसील हेडक्वार्टर्स हॉस्पिटल है गाजियाबाद लाहौर का एक अहम इलाका है जहाँ पे अस्पताल है, लेकिन शायद इतना अहम नहीं। के हुक्मरानों की नजर यहाँ तक पहुंच सके और महकमा सेहत ये जान सके कि यहाँ पर एक वार्ड बॉय है जो कि खाकरोब भी है, साथ साथ सफाई भी कर रहा है, लेकिन वो एक बच्चे के बाकायदा सर्जरी कर रहा है और टांके लगा रहा है उसके सर पर, जो कि आप फुटेज में भी देख सकते हैं। और इसके साथ जो उसका हेल्प कर रहा है वो एक अदद माली है, यानी एक खाकरोब और एक माली वार्ड बॉय जो है वो यहाँ पर सर्जरी कर रहे हैं। और ये अस्पताल जो 10 करोड़ की लागत से जो है वो तामीर किया गया था, लेकिन यहाँ पर जो है दिन में 2 डॉक्टर्स और शाम में 2 डॉक्टर्स की सीटें खाली पड़ी हुई हैं। एक गायनाकोलॉजिस्ट की सीट खाली है, एक डेंटल सर्जन की सीट खाली पड़ी है, लेकिन अभी तक महकमा सेहत ने इस अस्पताल की तरफ नजर नहीं जो है वो डाली। और यहाँ पर एक खाकरोब जो है वो एक बच्चे की, एक मासूम से बच्चे की सर्जरी करता हुआ जो है वो आपको नजर आ रहा है। उसके साथ जो हेल्प कर रहा है वो माली है उस अस्पताल का, गाजियाबाद का ये तहसील हेडक्वार्टर्स अस्पताल है, जहाँ के मनाजिर आप इसको टेलीविजन स्क्रीन पर दिखा रहे हैं। जी,
महकमा सेहत पंजाब की ये नाअहली है कि और गाजियाबाद अस्पताल में एक खाकरोब सर्जन बन गया है। इस फुटेज में भी हम देख सकते हैं इसे सर्जरी करते हुए। राबिया, बहुत शुक्रिया अपडेट्स के लिए।
Okay, now that lecture is over. So you have to consult the Parik, CK Parik for the studying of the negligence. And I have already shared the 2 names of the movies with the Harsha. So you should take the names from that guy, that doctor. Okay.